The increase in serious transmissible diseases over the past few decades have created global concern. At Synergy Dental, we assure a safe environment for both patients and personnel by adhering to strict sterilization guidelines. We have given particular attention to develop a well-designed sterilization area following CDC guidelines. The Center of Disease Control guidelines remain the gold standard for dental offices today. We have a contemporary design with 4 critical areas. Zone 1, which is the cleaning and decontamination area. Zone 2, which is the automated washing, rinsing, drying, and lubrication area. Zone 3, which is the packaging and sterilization area. And Zone 4, which is the storage area. The Sterilization Center is designed to have a one-way workflow from contaminated zones to processing zones to clean zones. The sterilization is carried out in a systematic manner using a stepwise process. We use standardized trays for each treatment procedure. After each procedure, the instruments are placed in closed trays and they are then transferred to the sterilization area. The instruments are kept on the unsterile side. Foot-activated drawers for waste management ensure touchless use. Biomedical waste is disposed in color-coded containers and sharps are placed in the sharps containers. Deposits and debris left on instruments can be cleaned with an autoclavable brush, and small pre-soak containers can be used for burrs, files, etc. The use of elbow-operated tap ensures a touchless technique. Cleaning can be time-consuming if handling each instrument individually. It also causes more risk of sharp injuries. We therefore use cassettes like the pink cassettes you see here, which are safe and efficient to package instruments, and there is no direct handling. This wastes less chairside time and the instruments are more organized. The cassettes with instruments are then placed in the immersion box from DIR. This avoids debris from drying out or hardening on the instruments. These pre-soak containers have enzymatic gels which easily break down the debris till you can clean them. The closed trays are then wiped with disinfectant wipes and they are then stored in a clean overhead storage place. The impressions, which are contaminated with saliva, are then placed in the immersion box, which is the Heiko box from DIR Dental, Germany. After immersion, the impressions are kept there for 10 minutes and then they are placed in a tub for transfer. The instrument from the pre-soak containers are rinsed and they are then placed in the ultrasonic bath, which is from Biosonic, Coltine, Weilden, Switzerland. Biosonic uses ultrasonic cleaning of instruments with high-frequency sound waves. The sound waves are enhanced by specially formulated cleaning solutions which create high-energy cavitation. During cavitation, millions of bubbles form and implode or collapse. This releases enormous amount of energy and shock waves which scour the surface of the instruments. This powerful scouring reaches into minute crevices, removing large and microscopic debris which manual brushing cannot reach. These are again rinsed after the ultrasonic cleaning and they are then placed in a dedicated sink with cover for drying. Prior to sterilization, it is critical to dry out the instruments thoroughly. Automated handpiece cleaning and lubrication is done in the Assistana from WNH, Austria. The instruments and handpieces are wiped and disinfected, and they are then placed in sterilization pouches. The sterilization pouches have indicators verifying successful sterilization. The instruments are then packaged and ready for sterilization. If more area is needed, we have an extended tabletop which can be used for packaging. The instruments are then sterilized in an autoclave, which is the Malag Class B autoclave from Germany. The use of a Class B autoclave is ideal as it has a pre- and post-sterilization vacuum, and it can be used for hollow instruments such as handpieces and implant drills. After sterilization, the instruments are then removed and placed in a clean area. We store them in the overhead storage of our sterilization center.